Hello, this is Dr. Dean. If there's one thing I don't want to talk about the eye, that would be floaters. The reason is threefold. First, it's so common, I get tired talking about it, probably on a daily basis whenever I'm at work. Two, it's so common that everyone is already talking about it, and there are great resources out there on the internet, including on YouTube, and given by people who are much better talkers than I. And three, there is really limited treatment option for this. The number one recommendation is to monitor the symptoms. Do people really need me to tell them again and that sorry, there is no treatment for this, you just have to get used to it? In fact, I plan on another great topic for this video, but today I feel like I have to talk about floaters because it is happening to me right now. And that's all I can think about. So I'm going to present the patient and doctor's perspectives simultaneously, and that should be pretty unique. So remember in the last video on the eye injuries, I mentioned that my son elbowed me in the eye. We were laying down in bed, cuddling like this. He's right in front of me. And all of a sudden, he just flipped and his elbow hit me right in the right eyeball. I had pain immediately. It was about 4 out of 10. And it lasted about 10 minutes. But then it went away. I did not think too much of it. A day later, I was just walking up the stairs at home when I noticed more floaters superimposed on the steps I was taking. The floaters got progressively more and more as the minutes went on. One of them also had kind of a shimmering effect on it. So I found a white wall and closed my left eye first. Floaters were there. Then I closed my right eye. Floaters were gone. So I was hoping this is another migraine aura, but it's not. It's only in one eye, so it's a retinal problem. I have to say that I've always had floaters in my life. As early as 8 years of age, I remember looking at the blue sky and seeing tiny fibers floating everywhere. So I just know it's something that my eyes have. About 10 years ago, I started seeing a black fly in my right while I was having lunch at work. But then I realized it was not really a fly in my lunch. So I went to see an ophthalmologist at Mass & Ear where I happened to be working at the time. I had a dilated eye exam, and I remember the doctor saying, "This is the first non-depressing case of the day." Apparently, he had seen many patients with bad vision or poor outcome that day, and I was the only good case thus far. So me seeing a fly was really nothing so grave. I left with a relief. Obviously, I'm still seeing the fly, but it's fine. Not a big deal. There was no treatment, just monitor the symptoms. And for the next 10 years, I still see the fly from time to time. My right eye was more blurry than my left eye because the fly was right in the center of my vision. But if I just move my eyes around it or turn at a certain angle, I could lose the fly and see better. Of course, the fly was quite persistent, and it would sneak back into the center of my vision again. However, I was not much bothered by it. I had my left eye that works perfectly well. Well, that is until now. These new floaters, multiple hair strands, are currently floating around in my vision, covering the top, the bottom, the left, and the right. You know that sometimes there are hair strands you find in a shower drain. I have about 6 of them right now, flying, with a good old fly still in the center. I almost forgot about the fly now. The way they fly around is just like when you are swimming in a pool, you see some hair floating around. It's just like that. In addition, my central 30 degrees of vision is now also covered with hundreds of tiny black dots. And this is where I would always tell patients, if you see a shower of black dots, you should call us right away or go to the emergency room if it's after hours. Because the worst case scenario is that the retina is broken and cells are released into the vitreous. I guess the silver lining in all of this is that I actually don't see any flashes of light. Flashes are caused by the vitreous pulling on the retina. When there is pulling, there is a possibility of pulling the retina off, causing a retinal tear, which may lead to retinal detachment. So that's the worst that can happen in a situation where you see more floaters. So previously, when I saw the fine fibers floating and later on the fly floating in my vision, that was liquefaction of the vitreous called vitreous syneresis. What is the vitreous? Here's a model of the eyeball. Front of the eye, the lens, you can see the retina here, and within this cavity, it's now filled with air. But if you can imagine a jelly piece is filling this ball, that is where the vitreous is, and that is basically what vitreous is. When we are born, the vitreous is one solid piece of jello. It is made of collagen fibers, carbohydrates, and holding onto water around them. However, as we get older, the vitreous gradually undergoes liquefaction, which means fluid pockets begin to form here and there everywhere in the vitreous. Some people will therefore notice floaters. And even as early as 4 years of age, the vitreous starts this process, liquefaction. But these floaters tend to be very small, and not everyone will even notice them. As we get older further, a process called posterior vitreous detachment takes place, or we abbreviate that as PVD for short. You see, the vitreous jello originally is firmly adhered to the retina, that is this yellow tissue behind it. The retina has blood vessels coursing through. With time, and especially with liquefaction, there are more fluid pockets inside the vitreous. It gets weaker and weaker, and many points on the retina, the vitreous actually starts to separate away from the retina. So that is the process of having PVD. There are actually 4 stages of PVD. In stage 1, the jelly loses grip around the macula. Macula is the center of the retina. And in stage 2, the jelly loses contact with the macula. So in the first place, it's around the macula that's being detached. But in the second stage, the entire macular region, the vitreous, also gets detached. In stage 3, the jelly further separates from the retina, and it then becomes only attached to the optic nerve head. Optic nerve head is right here, this yellow dot here that has the optic nerve as well as retinal blood vessels. To finish it off, in stage 4, the vitreous gets away completely from the optic nerve head as well, and that's considered a complete PVD. What happened to me now is probably stage 4 PVD. So honestly, in any of the stages of the PVD, you could start seeing new floaters. So it's not just whenever you have a complete PVD. Now imagine you're the doctor and I'm the patient. You look into my eye and see this. In this image of my retina, you will see that there are multiple shadows casting onto the retina from the vitreous jelly. And these shadows are caused by these new floaters. I have pointed out these new floaters with arrows. It so happened that 1 month prior to this happening, I had my routine eye exam. I had a fundus photo taken. That is a photo of my retina. It's a different camera, so the colors are different. But you could see that there's a dark line along one of the retinal vessels. I did not just grow a new vessel in a month, right? It is the fibrous stuff left behind when the vitreous pulls away. Now let me show you a cross-section photo of my eye, and you will see what I mean. Right where the vessel is at, you see a bunch of stuff that I circled in red. Those cast shadows to the retina, and I know exactly where it is because right there I can see a floater shaped like an eyebrow in my vision. This kind of view also shows another floater well, which I circled in blue. And here you can see the cross-section of my retina and vitreous in every section. All right, so this is the image of my retina in cross-section. And this highlighted area here, these are the retinal layers. Above that is the vitreal layer. And you can see there are clusters of floaters already, and these are cloudy, and this is definitely not clear. And this line, that's the vitreous interface, and it's separated from the retina. As the images go through each position on the retina, you can again appreciate the cloudiness inside the vitreous and the fibrous tissue here, and there's more clumps and here as well, and big floaters there, and the interface between the retina and the vitreous. So in acute PVD like this, where a patient has symptoms with floaters, sometimes they even have flashes. If you have both floaters and flashes, then that's even worse. Your risk of having a retinal detachment or tear go up even further. It is not something minor, really. With symptomatic PVD, it is estimated that the risk of having a retinal tear is as high as 15%. That is not a low number. That is a scarily high number. So if you have any of the symptoms like flashes or floaters or both, you really should go to the eye doctor immediately. Have a dilated exam. Make sure there's no retinal tear or detachment. So in my case, I don't have a retinal tear. Thank God. I do have a PVD. What do I do now? As I mentioned earlier, you actually just monitor the symptoms. There's no treatment for this right now. So you have to continue to be vigilant monitoring the symptoms, because in the first several weeks, when this process is still fresh, the actual adhesion of the vitreous to the retina is still present here and there. So in the next few weeks, some of these adhesions are still gonna break off, and vitreous is gonna further pull away from the retina in all of the locations. And in that process, new tear can form, and these new retinal tears may lead to retinal detachment. So if you start seeing new floaters again, or seeing flashes of light, you should still go to the doctor urgently to make sure no retinal tear or retinal detachment is happening. This is where I hate floaters. You leave someone with very disturbing and bothersome visual issues constantly. I see the disgusting hair strands even when I close my eyes. As long as there's light, I see the floaters. And you tell the patients that their brain will get used to it, that it's hardly of any help. In fact, many brains don't get used to floaters. For example, I still see my fly that started 10 years ago. It does affect my fine vision when I have to focus on details. I compensate by using my other eye. The floaters will not just go away. The stuff will stay in the eyeball forever. However, I do feel that though they're still gross, I feel less disgusted by them. It's like you hate rats, but if you have to see them every day, all the time, they become less obnoxious. I would tell patients to wait it out. Give it 3 to 6 months and see how it goes. While some people stop noticing them most of the time, others will continue to be bothered by them. Do we really have to suffer this and have no treatment at all? Well, in fact, we do have 2 ways to get rid of floaters. One is a surgery to remove the vitreous jelly called vitrectomy, and the other is a laser to break the big floater into smaller pieces so they become less noticeable. For vitrectomy surgery, there are a few notable possible complications. For example, cataract formation if a person has not yet had cataract surgery, and that's almost 100%. Sometime after the vitrectomy surgery, person will develop cataract. In addition, complications like serious infections of the eye and retinal detachment may occur, though these are rare. Do I want to do the surgery to remove my floaters? No, thank you. And most patients will not be bothered enough when they hear about the possible complications of the surgery. How about the laser? It works well on those with relatively few but large floaters. It may also carry a risk of inadvertently burn the retina, especially if the floater is very close to the retina. I will pass that also at this point. What I do notice is that our eyes are constantly moving. I'm on the computer a lot, and even though I'm not really moving my head, I'm not moving my eyes around, I'm reading. And as I move my eyes in that motion, that's called a saccade. It's eye movement that you do when you read a page or you read from any sources. And in this saccadic movement, that's enough to jolt to the floaters so they would move around again. Our brain is quite good at suppressing a static background noise of an image. So if the floaters are static, not moving at all, then the brain will get used to it easier. However, given that our eyes are actually moving all the time, even when sitting down to read, that just makes it very difficult because you would see the floaters moving around as you move the eyes, even though with just the slightest movement. Usually, people start developing PVD more after they're 50 or 60 years of age. However, people with myopia or nearsightedness will be more susceptible to it. The reason is that in myopia, the eyeball is significantly longer. So suppose this is a normal eyeball without myopia. If you have myopia, your eyeball is not here in this shape. It's going to go over like here. And it's like stretching a balloon out further. The retina is thinner. The vitreous jelly is also stretched a bit. So in that sense, the vitreous becomes weaker more easily. It separates away from the retina more easily, and therefore patient suffers from a PVD likely earlier than regular. So that's another aspect to why you don't want to develop myopia. And even if you do develop myopia, the less the better. You don't want a high amount of myopia happening because the higher the myopia, the longer the eyeball will be, the weaker your retina is, as well as the weaker your vitreous is. So you will likely have more complications such as retinal tear, retinal detachment, as well as myopic macular degeneration compared to the general population. Check out my videos about myopia and myopia control. This is something that you have to control when you're a kid, when your eyes are still developing. Another risk factor for developing PVD and, frankly, retinal tear and retinal detachment would be eye trauma. So blunt force trauma to the eyeball can really weaken the vitreous, can have the vitreous maybe prematurely separate from the retina and pulling the retina off in the process. So do I think my son's elbow in my eye had anything to do with this PVD that I am having prematurely? Maybe. It could also be a coincidence. After all, I also have myopia, and so my eyeball is longer than average. Another fun fact about PVD is that the older you get, the more likely you will have it. Even if you have no myopia, no eye injury whatsoever, when you're in your 80s, chances are you will have a PVD. So in this sense, it's almost like gray hair, wrinkles, or cataract. Everyone will get it eventually. But be careful whenever that happens. If you have symptoms, you do have a risk of getting a retinal tear and detachment. So always go to the eye doctor when something new happens. New floaters, new flashes. So in conclusion, posterior vitreous detachment can happen to anyone, especially those with myopia and those with eye injuries. And that happens to this tissue here in this eyeball cavity called vitreous. It will separate from the retina. Eventually, you would see probably many floaters and hopefully not flashes. And during this process, the best thing you can do is to monitor the symptoms very carefully and go to the eye doctor if anything is different or new. And if you happen to have a retinal tear or detachment, God forbid, it's not the end of the world. Doctors will be able to repair that with surgery or with laser. But if you only have a PVD without any retinal problem, you may not need to do anything. Just observe the symptoms. Chances are you will get used to it. And if you don't, you will learn to live with it. And as for me, I'm waiting for the floaters in the other eye to come maybe years from now. And for now, I know when I'm playing with my son, I'm gonna do this. Alright, that's it. Take care. Bye bye.